Okay, so moving forward to look at the traditional antenatal care. Okay, traditional antenatal care. So the traditional antenatal care, it just refers to an earlier model of pregnancy care. So it focuses primarily on limited number of scheduled visits to a healthcare facility, often with minimal emphasis on individualized care or broader health education. Like this one was mainly on trying to reduce the number of times that women came to the hospital. And I'll tell you that one of the reasons why this was actually implemented was probably because the resources were not really much, so they were not trying to just control population around healthcare facilities. Okay, not that they were trying to like reduce how many times women came to the healthcare facility, just to attend to them better. Do you understand? They were just trying to reduce the number of times they come to the hospital, probably just to reduce the population so that other people can come. Okay, so the visit-based model, they were actually trying to encourage them on coming to the hospital just 4 times during pregnancy. Okay, although the visits were focused, but not really, in depth on trying to individualize the care. Okay, facility center. So care was mostly delivered in the clinics or hospitals. There was no really community or home-based support. Medical focus, they focus on physical examination, they try to monitor the baby, and they also screen for any complications. Okay, limited scope, so they often lacked comprehensive counseling on nutrition, mental health, okay, how the woman will prepare for birth, okay, and after giving birth, okay, the outcomes. So limitation of the traditional antenatal care is there are a whole lot of missed opportunities, and things were not personalized. Okay, the mother at the end, she was not really satisfied. Okay, with reduced flexibility, so especially for women in remote or undeserved areas. Okay, so they now shift it from the traditional to the modern, antenatal care models. So it was in 2016, the World Health Organization now shifted it from 4 visits. They now say 8 contacts. So it was no longer 8 visits, you understand? They said the difference between the contact and the visit is visits you could actually just come to the hospital without not anything happening, while the contact is more of like, yeah, you actually came to the hospital, you were attended to, and all of that. So quality was now more emphasized. Okay, much respect, everything done was now centered on the person. They now focus on mental health, how you are eating, okay, birth planning. So also community-based and digital health support. So that's what we have here for the traditional antenatal care.